Welcome back to Net Talk 757. We are on Norfolk State's campus with athletic trainer Nicole and outside hitter setter Angie. And we're going to be talking about the two major injuries that occur with volleyball players, at least in my opinion, as a non-expert, right? And that is things with the rotator cuff and things with knee injuries. So we're going to let Nicole and Angie take over here, and they're going to discuss those two injuries and some preventive medicine dealing with those two injuries. All right? Ladies, take it away.
Okay. Hi, everybody. So pretty much with the rotator cuff, it's all the muscles kind of that shape around the shoulder joint, okay? So just inform here, you have your deltoid muscle, and then kind of all like a couple muscles that go around the shoulder as well. So you have your supraspinatus muscle, your infraspinatus, teres minor, teres major, and subscapularis. And they all kind of fit into your humerus here. So they kind of all do different actions. So those are the muscles that help pretty much lift your arm up, lift your arm to the side, help rotate, come up, rotate out, and then rotate in, okay? So a lot of the volleyball girls, reasons why you get so many issues with your rotator cuff muscles is because of overuse. A lot of times it stems from anterior tightness, especially lately, especially because cell phones and texting has become so big. You see a lot of people kind of walking around with their shoulders forward, or their chin kind of forward out, and especially, unfortunately, like the younger generation seems to be having more and more.
Yeah, that's my son.
Yeah.
My son looks like he walks with a permanent hunch.
Yeah. So yeah. So if you're, especially if you're even setting or trying to hit, and you're trying to come out, extend, you know, horizontal, this is horizontal abduction coming out and trying to swing for a ball, it's really hard when a girl's already coming like this and coming out and coming up like this. So already that since your shoulders are so forward, it's gonna stretch out these muscles in the back. It's gonna make stretchers in the front really, really tight. And that causes all kinds of havoc on your shoulder. Since when that happens, it tends to shorten scapular muscles in back here. Scapular muscles are really important to help keep your shoulder blade in place and help with stabilization. So when you're getting into bad posture, you're stretching these muscles out, these muscles are becoming weak, these structures are becoming tight. So then you run into things like tendonitis, rotator cuff tendonitis because of overuse, impingement issues where there's certain muscles that run through here, they run through a little tunnel. So they're becoming overused because they're trying to do stabilization and actually try to perform their action they do coming up, and then they keep getting pinched. Also, your bicep tendons kind of come in here too. So again, if you have that forward posture and your bicep tendon is kind of being short, and then you're trying to raise your arm and kind of stretch it out, it's just being overstretched, overstretched, overstretched. So then again, you're running into a lot of bicep tendonitis issues as well. So major thing, posture is really trying to help those kids keep their shoulder blades down, keep their shoulders back. Basic exercises, like especially just doing some doorway stretches, or even if you have a lot of partner stretches you can do, kind of bringing them up, making sure their traps stay down, kind of rotating them in. This is called internal rotation, just getting that stretch in the front and in the back, and then going out, getting some external rotation as well, kind of getting in the back. There's a lot of other good stretches. If we go back,
yeah,
I'll show you. Okay.
Yeah.
Kind of put your arm up and L, and then you're going to bring your hip in, and then it's another good anterior shoulder stretch. Again, you should only be stretching to where you feel a stretch, not where you're feeling pain or any kind of really discomfort. It's like should be a good stretch where it's pain-free. Another good stretch is going into a doorway, and if it's a wall here, you're kind of putting both hands on the wall, and then you're leaning forward. It's another good anterior shoulder stretch. Let me grab it out. Can you grab a band for me?
What color?
The purple. To get like the posterior capsule too is a good stretch. Is you're actually going to be stretching arms that's behind your back, and they're going to be pulling up with the opposite arm. So you should feel a stretch. Feel a stretch in the back. So those are some really good stretches to begin with. And actually you should be trying to do like pre-stretches, so pre-practice stretches, and post-practice stretches as well.
Say that again. That's huge.
Pre-practice stretches and post-practice stretches, especially after a long session, because depending if you're an athlete and you're really trying to change your swing, or coaches are trying to correct things, you're going to need stretching afterwards because their structures are going to get tight, just because human beings aren't supposed to be hitting balls overhead, so that's why structures get tight, and just kind of going through the swing. And if you're already predisposed to it, kind of injuries because of your posture, that's another big thing too, is trying to make sure that you get structures loose, that you're able to use the correct muscles to help stabilize the whole shoulder girdle.
Now, before we get into the knee situation, which is the next thing I want to do, can you show us a few, maybe with the band, a few band exercises to strengthen the rotator cuff and shoulder area?
Yeah. And then actually, I'll show you some scapular
Perfect.
exercises too. So before you get kind of into rotator cuff muscle, we'll do some scapular, what I was talking about, especially with the mid-deltoid and the rhomboids. So I call this money what money, because pretty much you're going to start, I know this makes me dizzy. So we start in kind of the what position, so and then people are like money, and then you're going to go what money and come out. So what you're going to do, so by doing that, you should go ahead. See how Angie is squeezing my finger? That's how her shoulder blades should come in. And also, see how Angie is keeping her traps down? That's another very good thing that you need to do. A lot of people, what they want to try to do, if they're especially weak here, they're going to do this because they're trying to get overcompensate for these lack of weak muscles. So again, it's really keeping your shoulder blades down. By pushing out, it's squeezing. The same thing. A lot of my athletes, I'll tell them, pretend there's a tennis ball there. You're trying to squeeze that tennis ball as hard as you can. Hold 3 seconds and then relax. So again, kind of with our prevention program, I had a lot of girls do like 2 sets of 10, 2 sets of 15 of these exercises. Another good exercise is doing rows for scap. Keep your elbows tucked in. Same thing, try and see if Andy wanted to keep your shoulder blades down. Okay, squeeze the tennis ball, come back, adjust, and then go straight ahead. Okay, and then come back.
So keeping the shoulders down is one of the major key things.
Because you don't want this upper trap to get hypertrophy, so you don't want that muscle to get bigger and try to take over for everything else, because you're going to run into a lot of muscle spasm issues. Again, you're going to run into scapular weakness, going down the chain, then it's going to get into the whole rotator cuff, and then
And I think it becomes tough because I know a lot of coaches, and I'm one of these too, who, you're asking your players to do this prior to practice starting. And you're busy talking with your assistant, or you're busy setting up the net, or you're busy, getting things straight. And the players are doing it, and they're not necessarily self-monitoring themselves. And the next thing you know, the shoulders are getting up here, and one thumb's down and one thumb's up. So, maybe coaches just even telling them may not be enough. It may take a couple weeks of really making sure and overseeing it and making sure they're in the right position to where they can start to field, or maybe if they're mature enough, monitoring each other rather than just saying, go to it.
Yeah, no, and I agree. Yeah, exactly. And especially if you see somebody struggling really bad, don't try to push them through the end. If they can only get 10 good scap squeezes, then you just gotta work yourself up to that. Because the more you try to force them through it, it's gonna be really tough for them, and then they're gonna start using other muscles and hyperextending and time. Yeah.
Right. So after the scapula, then we're going on to the shoulder,
yeah,
right?
We'll do some rotator.
Here we go.
So we'll do internal rotation first, okay? So first one is just internal rotation.
Tom, that doesn't mean you're good at it. All right.
Right. So first one's internal rotation. And then the towel is there for support. Because a lot of people, if the towel isn't there, what they're going to do is kind of bring their elbow out. Is do that.
Right.
That's not doing anything.
So you squeeze the towel to keep the elbow in.
And that's predisposing you, again, for impingement, especially of this muscle, because you're kind of bringing up around.
So for coaches, obviously we don't have a lot of towels there, but
Or
they could
even
use
like
a
a
warm-up
t-shirt.
shirt, they could use a sock, they
Right.
could use, okay.
Something that keeps
Right.
it there so they keep their elbow tucked in. And then you're just doing that motion, going, pulling in. And then going opposite direction is extra rotation. And then let's do abduction since we're here. Okay. Oops, sorry. Just. So you're gonna have them go up, to right about shoulder level, and back down. Again, you don't want to go much higher than shoulder level because then we're gonna get in that realm of trying to get off that muscle, and we don't want to take off that muscle and get impingement issues. And then adduction. So we'll start from here. And then going down. And then extension. And the last one is flexion. And then again, same thing, you're only going just above to 90 degrees to your shoulder.
Excellent. Awesome. So now we've learned a little bit about some scapula issues, how to help them, and some rotator cuff issues. And so now the last thing we're going to do today is move on to the knee, because I know a lot of players are worried about the knee, and it seems like every single time someone feels something in the knee, all you hear people saying is ACL, ACL. And I know sometimes that's obviously the quick diagnosis, and it isn't. But we do see a lot of ACL issues and MCL issues these days. So let's discuss those real quickly and see what we can do about those.
Okay. All right. So just kind of some anatomy. So pretty much your MCL is your medial collateral ligament. That goes on the inside part from your femur all the way into your tibia, and then you got your LCL. Same thing. Goes from your femur all the way down into your tibia as well. LCL is more kind of in the joint. MCL kind of lays outside like your joint. So your knee joint is intact. Kind of has this like capsule over it. It's just fibrous material. Now deeper in the knee, you got your ACL and you got your PCL. ACL is the one that helps from your tibia shifting forward. So it stabilizes that motion. PCL stabilizes it from your shin from going backwards. Unfortunately, the reason why we get so many ACL injuries is because the common mechanism is kind of stopping. Your knee is facing one direction and you're turning. So a lot you'll hear, well, I stopped and I pivot and I turned. A lot of times you'll get, well, I felt a big pop, I heard a big pop. Those are some kind of warning signs from that, not all the time. Some athletes will swell up right away, some athletes not so much. Dealing with more MCL injuries, it's kind of more a force from outside the knee that's gonna be pushing in. From what I've seen with volleyball, a lot of it is doing agility-wise, stopping, turning, and their knee kind of goes in, or a lot of it is from player contact as well. Somebody gets hit on the outside, knee kind of bends in. A lot of LCL injuries is just opposite, so you're getting more applied force from the knee, so it's making this ligament open up more. Again, knock on wood, not too many issues with LCL, but it can happen. Again, player contact. Again, if just the right mechanism of stepping on an ankle and your knee decides to go out like that, so that can happen too. Biggest thing with ACL prevention, a lot of literature, a lot of fighting is how well your athletes are landing from their jumping position. Also, again, from the earlier segment, a lot of quad, hip strength and hamstring strength, kind of making sure that quad and hamstring strength are almost kind of equal, so not one is overpowering them. I'm gonna have Angie, I'm gonna have you demonstrate. Go ahead and demonstrate just a jump for me. Okay. So as you can see, Angie came down, her knee kind of faced forward, she jumped down lightly. So that's, even though Angie has this is why we call it a Q angle, even though she her knees force more in, but that's what we've been working a lot in rehab as well. Again, trying to get those glutes firing that she gets pulled out, especially when she lands jumping. What you'll see a lot, I'll do one because I know I'll do it. What you'll get a lot is individuals coming jumping and their knees go in. Right there, it's going to be a lot of accessibility for the ACL injury, especially if their knee or their hips are already stabilizing them, they're already coming down, their knees are going in this valgus position. That's really bad. So, kind of some things. I know we've been talking about a lot of jump training. I don't know if I can. I'm not. CHKD Children's Hospital King's Daughters have a really good ACL prevention program. Not trying to be biased, but they do a 6-week program with a lot of athletes. I think they have one coming up in June. Or even contacting somebody from CHKD, especially with sports medicine. They'll make arrangements, having somebody come out, kind of going over jumping mechanics, teaching them how to land correctly, how to jump correctly, coming down from that. So that those type of programs and those type of strengthening programs have helped a lot to try to kind of decrease ACL injuries.
Good, excellent. So again, we'd like to thank Nicole, NSU athletic trainer, and Angie for demonstrating a few things for us. And if you have any other questions about sports injuries or, lifting techniques or anything like that, conditioning techniques, contact us on Net Talk 757, and if we can't answer it, we'll bring in the experts to do so. Thanks again for watching, and catch us again, Net Talk 757, your one-stop shop in Hampton Roads. Keep digging.